You are over 50, and you feel a small itch on your skin. It comes back again and again. You think it is just dryness. But what if it is not? What if this tiny itch is the first sign of cancer? A silent cancer that starts without pain, without a wound, just an itch. And if you ignore it, it could cost your life. In the next few minutes, you will learn the hidden danger behind that one itchy spot and how to protect yourself before it is too late. This may start with something as small as an itch. No rash, no pain, no fever, just an itch. On the shoulder, behind the ear, on the scalp, somewhere you cannot see clearly. And because it seems harmless, you ignore it, you apply lotion, you change the soap. But it stays 1 week, 2 weeks, 4 weeks, still itchy, still there. This is not dryness. This is not weather. This could be the beginning of cancer. Older adults often have dry skin, but not every itch is normal. Sometimes that itch is the first warning of something deep, something dangerous. Skin cancer in seniors is often silent. It does not start with pain. It does not start with a scary wound. It starts with a mild itch that comes back again and again in the same place, and if it is ignored, it grows. There are 3 main types of skin cancer in seniors. The most common one is basal cell cancer. This type starts as a tiny bump. Sometimes it looks like a pimple, sometimes like a clear blister. It feels itchy, it heals, then comes back. The second type is squamous cell cancer. It looks like a flat red spot. It feels rough. It may bleed, but it starts with itching, and it keeps itching. The third type is melanoma, the most dangerous one. It may begin as a mole that begins to change. The color darkens, the size grows, and the mole begins to itch. This is often the only sign in the early stage. So what do you do when an itch refuses to go away? You watch it closely. You take a picture. You note the date and you check it again after 7 days. If it looks the same, you wait. But if it gets darker or larger or changes shape, you visit a doctor. Now let us talk about the 7 most common places on the body where these itchy spots appear in seniors. Number 1 is the scalp. Hard to see, often ignored but exposed to sunlight for decades. Number 2 is the neck, especially the back of the neck, where hair does not cover the skin. Number 3 is the face, nose, cheeks, forehead. These are exposed daily to sunlight. Number 4 is the chest, especially in people who have worked outdoors for years. Number 5 is the back, the most difficult area to monitor, especially for someone living alone. Number 6 is the arms and hands. Hands get sun every day. Over years, they build damage. Number 7 is the legs, especially the lower legs in women, where the skin gets thinner faster with age. Why are seniors at higher risk? Because the skin becomes weak. The immune system becomes slower. Old sun damage starts showing now. And many seniors live alone. No one checks their skin regularly. Sometimes the only sign is a small itch that keeps coming back. No rash, no sore. Just the same mild feeling that something is not right. Doctors say that if a skin spot keeps returning, keeps growing, or keeps itching for more than 3 weeks, it must be checked. Early detection can save lives and remove the cancer before it spreads. So how do you know if a spot is dangerous? Look for these changes. It grows in size. It changes in shape. It gets darker in color. It begins to bleed. It feels hard or raised. It forms a crust or scab. And of course, it starts to itch often. If you find any of these signs, do not wait. Visit a skin specialist. Get a biopsy. Do not ignore it just because it is small. Cancer starts small. Let us talk about a real story. An old lady had an itchy spot on her back. She thought it was dryness. She used creams. It stayed after 5 months. Her daughter saw the spot. It was big, red bleeding. It was skin cancer. It had already reached her lymph nodes. Treatment was painful and long. If she had seen a doctor earlier, a small surgery could have saved her time, money, and suffering. That is why checking your skin and talking about these signs is so important, not only for you, but for your parents, your grandparents, your elderly neighbor. Here is how to check. Once every month, Stand in front of a mirror. Look at your face. Neck, chest, arms, legs. Use a hand mirror to check your back or ask someone to help. If you find anything new or itchy, watch it for 7 days. If it stays or grows, visit your doctor. Also take steps to reduce risk. Wear a hat when going outside. Use sunscreen every day. Drink water to keep skin hydrated. Avoid harsh soaps. Do not ignore changes. Your skin speaks. You just have to listen. Now I want you to think about this. Have you felt an itch on your skin in the same place more than once? Is there someone in your family who scratches the same area often? Maybe your father, your mother, your grandmother. Talk to them today. Ask them to check. Ask them to take it seriously. Because early-stage skin cancer is easy to treat, but late-stage cancer is not. So please, share this message. Help one person check their skin. You might save their life. And if you want more videos that protect seniors, that save lives and spread truth, then subscribe to this channel, Elderly Wisdom Official. We care, we warn, we protect. You are not alone. We are here to help.